Hello everyone, my name is Giribabu Nelli. I am from Department of Physiology, University of Malaya. Today I would like to present one of my research topic on diabetic cardiomyopathy. The title is Cardioprotective Role of Hydroxycitric Acid by attenuating the TLR4 NFKB NLRP3 pathway in high-fat and low dose of streptozotocin-induced diabetic cardiomyopathy rats. It is well known that diabetes is a chronic metabolic disorder characterized by hyperglycemia due to the deficiency of the insulin secretion or increase the insulin resistance. Normally, type 1 diabetes caused due to the failure of the insulin production, whereas type 2 diabetes mainly caused due to the increase the insulin resistance. Worldwide, nearly 90 to 95 cases are suffering with type 2 diabetes. When you look at the epidemiology of the diabetes mellitus, worldwide, nearly 422 million people, adults suffering with diabetes, 1 out of 11 adults suffering with diabetes. Whereas in Malaysia, 1 out of 7 suffering with diabetes mellitus. When you look at the graph, we can understand in Malaysia, diabetes percentage was increased by year. Cardiovascular diseases are a group of disorders. It is a number one leading causing diseases in worldwide. Nearly 17 million people globally every year suffering with cardiovascular disorders. Nearly 31 percentage of global deaths because of the cardiovascular disorders. When you look at what are the main risk factors, it caused mainly due to the smoking, psychological disorders, higher cholesterol, higher blood pressure, and also diabetes mellitus. Diabetes mellitus also one of the main causative factor for the cardiovascular disorders. If you look at the pathophysiological changes in the diabetic cardiomyopathy, we know that in diabetic condition, hyperglycemia was increased and also hyperlipidemia and also insulin resistance also increase. These three factors can cause the increase the reactive oxygen species. When reactive oxygen species were increased, it lead to the inflammation, mitochondrial dysfunction and increase the fibrosis. Finally, it lead to the diabetic cardiomyopathy. Worldwide, so many drugs are available for the remedy for the diabetic cardiomyopathy, whereas these drugs can cause the many side effects like headache, dizziness, and some of the pains and diarrhea. So, these side effects can be decreased by some of the new drugs investigation. So, in our study, we used one of the active compound from Garcinia cambogia. So normally Garcinia cambogia mostly we can see in India and some of the Southeast Asian countries. So mainly this Garcinia cambogia can be useful for the decrease the body weights in obese patients and also decrease the joint pains. So from the Garcinia cambogia, one of the main compound is hydroxycitric acid. So HCA. In our study, hydroxycitric acid was used for in my experiment. So we hypothesized that Garcinia cambogia can reduce the body weights. So the main compound HCA also it can be reduced the body weights, and whenever the body weights was decreased, diabetes complication also decreased. So for for my model, type 2 diabetes rat model, we use like high fat diet treated rats and also low dose of streptozotocin induced rats. Normally 12 weeks rats was fed with high fat diet. At the end of the 12 weeks, we injected with 55 mg per kg body weight of streptozotocin. So it will be resembles to the type 2 diabetes in humans. The objective of the present study to investigate the ability of the HCA to restore the cardiac function in diabetic rats by the investigate the metabolic parameters, by the investigating the oxidative stress and the antioxidant markers, and also investigating the inflammatory markers in the diabetic cardiomyopathy rats. So if you look at my results, body weights alteration was significantly decreased in HCA treated 150 mg treated rats, and also blood glucose levels was significantly decreased in 50 and 100 mg HCA treated rats, whereas in diabetic rats insulin levels was significantly lower, and whereas HCA 150 and 100 mg per kg body weight treated rats insulin levels was significantly increased, whereas glycated hemoglobins was higher in diabetic rats. It was significantly decreased in 50 and 100 mg per kg body weight HCA treated rats. And cardiac markers like a CKMB, troponin, and BNP and LDH levels was significantly higher in diabetic rats. These levels was significantly decreased in diabetic rats treated with 50 and 100 mg kg body weight HCA treated rats. Whereas lipid profiles also high alteration was we notice TG, TC and LDL levels was higher in diabetic rats, whereas HDL levels was lower in diabetic rats. Whenever 50 and 100 mg per kg body weight HCA treated diabetic rats, TC and TC and LDL levels was significantly decreased, whereas HDL levels was significantly increased. So antioxidant engines was significantly lower in diabetic rats because oxidative stress was very higher. So in our study, oxidative stress was measured by the MDA levels. So in diabetic rats, MDA levels was higher, whereas 50 and 100 mg per kg body weight HCA treated rats, these MDA levels was significantly lower. Whereas antioxidant enzymes like SOD, catalase, and GPX levels were significantly lower in diabetic rats, whereas 50 and 100 mg HCA treated rats, these levels were significantly higher. And also, inflammatory markers like a TLR4, MYD88, NFKB, and NLRP3 also higher in diabetic rats, whereas 50 and 100 mg diabetic rats treated with HCA, these inflammatory markers were significantly decreased. And also in our study, double immunohistochemistry was performed like a TLR4 indicated by the red color, MYD indicated by the brown color. So in diabetic rats, red color and brown color was significantly higher. So it indicates TLR4 and MYD8 markers was higher in diabetic rats, whereas 50 and 100 mg per kg body weight HCA treated rats, these levels was decreased. Also, another inflammatory markers like NFKB P65 and NLRP3 was higher in diabetic rats. We can show with red color and also brown color. So red color and brown color higher in diabetic rats, whereas 50 and 100 mg kg body weight treated HCA treated rats, these levels were significantly decreased. From this study, we can conclude that HCA is one of the new drugs, so it can be reduce the alteration in the body weight, and also it can reduce the blood glucose levels and increase the insulin levels, and also it can be reduce the oxidative stress and also increase the antioxidant engines like SOD, catalase, GPX, and also this HCA can reduce the inflammatory markers like MYD88, TLR4, NFKB, P65, and NLRP3. So it can be conclude that HCA is one of the new drugs. It can be useful for the diabetic and also obesity patient for the decreasing the cardiomyopathy. Thank you.